Good morning.
Good morning. So we have Cecilia up first this morning.
Oh, we do?
Yes, she had a call that was moved around with the secretary, so Gia will be going second.
Okie doke.
Yep. So let me pull up her presentation. Okay. All right, and I will also pull up prepared Gia's as well. All right. Righty. All right, can you see Cecilia's presentation?
Yes.
All right, great. I am going to, looks like we got 11 people on the call. I do not see Cecilia quite yet, so I'm just waiting on her to join us. So if everyone could just bear with me momentarily. Cecilia did include her questions as an integrated feature of her presentation. So that I just wanted to let everyone know she's going to have a little question and answer section as part of her presentation. So you're going to see on your screen some questions, and how I'd like people to respond is through throwing the response that you have into the chat box so we can see if people are paying attention to the presentation. I'm sure everyone is. Okay. Just keeping my eyes peeled on my email in case she has any difficulty getting into the webinar. While we're waiting on her joining, I'm sure many of you have already had a little bit of experience doing Zoom meetings or webinars in the past. So just to kind of go over some of the features with this webinar, we have a Q&A option. So if you have questions during anyone's presentation, go ahead and include those in the Q&A, and we will, at the end of each presentation, go ahead and answer those questions. You may also raise your hand and I can unmute you if you are joining by the computer to ask any questions you might have. It will be a little tricky if you're joining by phone to ask questions. What we've been advising people is if you are on the phone and you're joining that way, I'm going to recommend that you email me or Cecilia or Gia Wilkerson, who's from the Insurance Administration, any questions that you might have after the fact, and we can go ahead and follow up that way. This webinar is being recorded, so I just want to let everyone know that. And I'm going to, let's see, I'm going to do, let me see here. I would like to go ahead and get some captions up on my screen in the event anyone needs the captions. Bear with me. This was relatively simple last time I did this. It was just right there for me. All right, so Cecilia's on the line, but I cannot hear you, Cecilia. So I don't know if you joined as an attendee or if you joined as a panelist. If you joined as an attendee, then that is why I can't hear you. But I do not see you on as either. So bear with me one moment, guys. My apologies. Make sure that this Cecilia is able to log in. Let me see if she's All right, Gia, I see you on the line. I promoted you to a panelist. So I have you on as a panelist right now. I just want to let you know. And I do not see Cecilia. I don't know if you joined by phone, Cecilia. I might not be able to see you in my list. Or you might be coming up as like a phone number or something like that.
I don't see anybody coming up as a phone number.
Yeah, I don't either. That's why I'm a little confused as to how she joined this. Let me copy the link. I'm wondering if she may have joined a different thing completely. It's possible. She might have joined a Google Meet or something like that. Okay, so one moment. I'll see if she got on as of yet. In the meantime, let me see if I can get some captions on here. As well. Okay, so I see one person who joined by phone. I'm wondering if that might be her. I cannot guarantee that. All right, so, okay. Okay, we have some people saying that they are unable to find the passcode that should have been in the registration link. So I'm going to go ahead and I've had a couple people email me with some technical difficulties this morning. So
The passcode was included on the constant contact notice with the link for the webinar.
yes,
So
yeah,
that.
I'll go ahead and send that. Karen Scott is trying to join and she just needs the passcode. So I'll go ahead and paste it, send that to her. My apologies for all of you who have already joined. I'm just kind of trying to get through some technical difficulties with getting our first speaker on the line, Cecilia Warren from our department.
We have one person on by phone. Would that be Cecilia?
I just asked her that. And she did not respond. I think she's getting a little confused with the different links. She is not seeing the email I sent her that included the right link. Okay, so I see her on now. Cecilia, can you hear me? Okay, Cecilia, you had put yourself on mute. So can you hear me?
I can hear you. Can you hear me?
Yes, I can.
Okay.
Okay, great. So I have your presentation up now.
Okay.
Can everyone see Cecilia's presentation?
Yes.
Diane, I guess you're the
Yep,
only
we
one
can see
other
it.
person who can unmute. Okay, excellent. Thank you. Great, Karen, thank you for letting me know that you can see your presentation. I'm glad you got in. Everyone, well, thank you for joining us this morning for our second webinar in a series of webinars for our annual property manager case manager meeting. Normally this is done as a one-day event, and fortunately, at the very least, one of the benefits of the doing all of this virtually is that we can record the information and we're able to post it to our website, and you can share it with anyone who you think might benefit from knowing some of this information. So I want to thank our panelists for today for joining and sharing a little bit of their expertise. Cecilia Warren, who is our policy director for emergency preparedness. She works for the Department of Disabilities. She is excellent presenter, very knowledgeable of her subject area, and we've had her join us in past webinars. I'm glad she's able to make it today, and some information on emergency preparedness, specifically for property managers and case managers in this rapidly changing world due to the pandemic. I would say that emergency preparedness has come to mean something very different than it may have meant before. So there's a lot of changes and new considerations that residents in the 811 and Weinberg programs have to think about now. So without further ado, Cecilia.
Oh, thank you. I apologize. Hopefully my presentation skills are better than getting on the presentation skills.
Okay.
It was a little bit rough there. I would like to welcome everyone. As Chelsea mentioned, I'm the Director of Emergency Preparedness Policy at Maryland Department of Disabilities. In keeping with the Governor's order on social distancing, we are co-located today for this presentation. So before we get started, I wanted to thank our housing team and also to thank you for your efforts to help Marylanders find safe, reliable, affordable homes. Today, we will be providing training on how to assist your clients in developing their own disaster plans. There is no one specific method for this task. Our role is to provide you with the resources and guidance necessary to assist your clients, and at the end of the presentation, we will also review some COVID-specific resources that may be useful in your work with clients. After the presentation, you'll be receiving 2 documents electronically that I'll be sending to Chelsea, and these will also be useful in your resources for the future. One document is planning for people with disabilities and others with access and functional needs. That will be useful in your resource library, and it was created for planners and emergency managers. And we will not be referring to that today in the training, but for people who wish to dig deeper into this topic or have a particularly complex case, you will find that this toolkit is a comprehensive resource. The other document that we'll be sending is actually a number of separate forms and templates that we've combined for your optional use. So next slide, I'd like to start off with a little cartoon. And in this frame, you'll see the dog that's trying to teach the other dogs what the disaster plan is. Phase 1, bark. Phase 2, bite. If this is what your disaster plan looks like and you need to step it up a little bit, then you're in the right place. The third slide, please. So the emergency management process, just so we can sort of put this all in sort of a framework, this image shows the cycle of emergency management. The first part is preparedness, which is what we are discussing today. The response is when the start of the incident occurs. Response and recovery are very resource-intensive processes. Oftentimes, we start recovery planning before an incident even occurs. In a presidentially declared disaster, we don't typically see federal assistance start to arrive until the recovery process. Mitigation are all of the actions that are taken to reduce the impact of a hazard. For example, automatic fire sprinklers don't prevent a fire, but they certainly can mitigate the spread and damage a fire can cause. Next slide, please. So children and adults with disabilities are 2 to 4 times more likely to be injured or die in a disaster due to lack of planning, accessibility, or accommodations. These are not due to diagnostic labels. Modern disasters cause a broad range of collateral problems for responders, communities, and survivors. Training and preparedness activities have long been planning tools. This process is never closed, and it must evolve and accommodate changes and developments. In order to improve outcomes for people with disabilities, we need to incorporate new bodies of knowledge. And assisting your clients with developing a disaster plan is an important step in ensuring that they know what to do and where they can find resources prior to an incident. Next slide, please. So I would like you just to imagine for a moment the impacts of a multiple day incident. And I'm not speaking of COVID necessarily. We're speaking more of maybe perhaps even a natural disaster. So there are many impacts that become immediately a problem and then problems sort of down the road, you know, days or weeks into an incident. So if we imagine that an incident goes on for days, such as the derecho or Hurricane Isabel, it was not uncommon for urban communities to be without electricity for a week. Sweltering heat, no air conditioning, and a disaster of this size can also impact commercial businesses. Without electricity, fuel pumps cannot operate, point of sale devices can't accept credit cards, ATMs can't dispense cash. The demand for food and water reaches a tipping point within days. And in an event where there has been plenty of notice, their supplies can be depleted before the actual disaster, such as a blizzard or a hurricane. And we have not even discussed what happens to public safety and other government services. So the need for help quickly outpaces the resources available. Even with mutual aid agreements, the local jurisdictions can deplete all of their resources for a large incident. Next slide, please. So what we're trying to do is create resilience and increase resilience. And we defined resilience as the ability to anticipate risk, limit the risk of the impact of the risk, and to bounce back after an incident. Resilience is built through all of the steps that you take before, during, and after an emergency or disaster. This is to be safe and to return to a pre-disaster status. Our goal is to build resilience. In the context of disasters, resilience represents the capacity of a community to return to normal operations after an incident. Resilience can be reinforced by thinking ahead about the chain of events that are likely to occur. Next slide, please. So first we start thinking about what will survivors need. Of course, I list a number of the basics here as far as food and water, healthcare, perhaps even transportation to dialysis or other healthcare services, replacement of durable medical equipment and medication. And we seek to provide support in the most integrated setting. In other words, we don't want to separate survivors from their community. There are also a number of other services or unmet needs that could exist for survivors. For example, they may need assistance with insurance claims. They may need to replace vital documents such as government IDs or birth certificates, and they may require temporary shelter. Next slide, please. So also there are derivative impacts. The impact of the disaster, what it has on the household. For people who do not have financial resources, a disaster can ultimately place them into poverty, sometimes homelessness. They can lose all of their savings due to the cost it takes to evacuate. And they can also have difficulty in receiving accommodations during recovery or in recovery services. Next slide, please. So one of the things that one of the activities we seek to do with clients is provide time to create a disaster plan and what needs to be in the disaster plan. Now, as I mentioned before, there is no one size fits all, but there are some typical elements of the disaster plan. And it should include the steps one should take to be safe and return to a pre-disaster status. Disasters can be categorized into naturally occurring, technological or accidental, and man-made or intentional. Next slide, please. So first, a simple review of some of the naturally occurring disasters or risks. I chose ones that are most likely to occur in Maryland, such as tornadoes, windstorm, blizzards, floods. We do have the rare earthquake. And I'm sure that the next speaker will have much more expertise in all of these naturally occurring risks, since this is something they commonly encounter with constituents. But here we have a photo from a flood in Salisbury. All of these photos today, for the most part, are from Maryland properties. There were a number of families temporarily displaced from this incident. This was a few years ago. And then in the next slide, we have some examples of man-made or human origin type incidents, such as a security breach, theft, fire, workplace violence, civil disorder. So one of the comments that I like to share, especially with case managers and property managers, is that we always need to be vigilant about fire prevention and security. Always maintaining situational awareness, and having these conversations with clients, tenants, maintenance personnel. It helps to reinforce what should and should not be done. The next slide. Yeah, this is the last sort of category that we created for this presentation. So the unintentional or technological risks. and that would include power outages, failures of the HVAC system, interruption to a fuel supply, interruption to 911 telecom, water supply, contamination, things like that. So in this photo, this was a devastating gas leak explosion at Flower Branch Apartments in Silver Spring, and this disaster killed 7 residents. All right, next slide. So how do we know what the risks are, and how do we identify hazards we should be planning for? And sometimes that requires a little detective work, but there are a number of online resources that we will discuss. One of the resources I commonly refer to is the Hazard Mitigation Plan. It's required to be done every 10 years, I believe, and also the local jurisdictions often have their own hazard mitigation plan. And they're usually available online. And if not, the emergency management office of your local jurisdiction would be able to provide that. But some of these sources of information, of course, valuable information can be found from data. Also, local news reports can be helpful. And so in the next slide, we have some sources for your local hazards. And one, of course, regarding natural disasters and weather related would actually be the Weather Service. And federal flood maps give a lot of historical data. And the local emergency management office should be able to provide information on what the top 10 local hazards would be. Okay, next slide. I apologize for the ringing phone. I'm still working on COVID business here, so my phone is constantly ringing. So here we have some questions you can review with your client in creating your documents. And there is a template that is within the documents that we'll be sending. And that file is the Housing Emergency Preparedness Plan. And so the first 3 pages of that plan will comprise of a family disaster plan. And there are a number of templates for creating various plans. And so the beauty of these plans are their simplicity, and you can use them to help others. But some of the information that will want to be recorded and articulated and eventually updated includes things like the names of the members of the household, including their pets or service animals, information on schools that the minor children would be attending, and what a good place to start is what disasters are most likely to impact their home. Next slide, please. So there are some other elements that should be included, and there always should be a plan, a date for future review, so that usually it's annually. Sometimes we review plans after a disaster and the plan's been activated, so that we can make corrections to things that did not go smoothly. And so at the beginning of the school year is another time that is good to update the plan if there are minor children in the household. One thing I want to point out, it's always important to include a meeting location out properties. They will actually designate a meeting point, like a certain parking lot or location far enough away from the building where everyone knows to join, so that they can be counted and to ensure that they're not missing. Next slide, please. So we hear a lot about creating a kit, and there are a number of lists and infographics online to describe what should be in a disaster kit. I chose this one because it's simple and does not include extraneous items. I do think there's a category that should be added, which is vital documents. Survivors need to have vital documents like birth certificates, social security cards, government issued ID to apply for various benefits and help. And so there is some more detailed information on the in the document that we will be providing. There's also can be useful information on like what type of food would be appropriate for disasters. Next slide, please. So in addition to the list for what to put in a kit, we need to consider specific needs that may pertain to an individual that is not a universal need. So people who have unique needs need to customize their kits. And I want to note that for assistive technology, it is just as important to have the charging device for the assistive technology because it may not be operable otherwise. We do keep a number of assistive technology kits for all of our statewide shelters, and the kits include a variety of charging stations. Please note that I have listed tire sealant for wheelchair users, mobility devices that have parts that may need frequent replacement, like cane tips, should also be considered. Individuals who receive home health care should have a plan with their service provider so that extra supplies, batteries, or medication can be provided in advance of a known event, such as a hurricane or a blizzard. Next slide, please. This pertains to food. So when we think ahead about all of the likely circumstances that a client could encounter, we need to make sure that whatever their dietary needs are, that it's considered, whether they have food restrictions, food allergies, or medical conditions that require a meal schedule for, they may need additional support. And of course, the nutritional needs for infants and toddlers should be included. Now, I just want to mention here, we will have COVID-related slides at the end, but when you have, if you have a situation where someone does not have food, we always recommend that they can call 211. We have placed a sort of community feeding information with the 211 service, and they can direct an individual to a distribution point for community feeding. And if they cannot get to a distribution point, some local jurisdictions have services where food can be delivered. Now, I'm not speaking of restaurant food, but specifically like feeding boxes, produce boxes, things like that from the USDA. Next slide. So let's talk for a moment about how critical accessible information is, especially warning systems. We have a number of important messages that have to be disseminated. Some of these are instructions. There may be information on shelters that are opening, emergency alerts, points of distribution for medicine or food, and even information on evacuation. So having accessible information is very important. And we have worked very hard to ensure that agencies have accessible digital information, updated web information. But I wanted to mention this because if you are providing that information and you have residents that have certain needs regarding using assistive technology or needing an interpreter, or English is not their primary language, then this should be represented in the plan, something you have to take into consideration. Okay, next slide. This is pertaining to the emergency.
Cecilia, we can't hear you for some reason. I don't know if your connection is.
Information card, what somebody would want to carry with. Uh-oh.
I can hear you now.
Okay, I'm sorry. Have you been able, did it just stop?
One slide it went kind of in and out, but you're okay now. I can hear you.
All right, so I'm going to throw some shade on Comcast because I think everybody in my neighborhood is working from home and that the bandwidth, I'm not sure if everyone has strong bandwidth. So I apologize. Yeah. I'm going to keep moving on here. Okay. So this slide on emergency information that should be carried. Of course, this is some of the basics, but in addition to these numbers, if a client uses a home health care company for prescriptions, nursing care, or durable medical equipment, that number should also be included. And in the packet we're sending out, there will be 2 examples or templates of emergency information cards that can be, duplicated. Okay, next slide. And so here I have some numbers that really are not required, but I found that it can be helpful to include so that clients can easily contact these services. Of course, during a disaster, one's stress increases and executive functioning may diminish. So having important contact information readily available may be helpful. Some of these, some of these numbers include their local offices of social services or human services, the local emergency management office, and animal control, and their after hours numbers for their medical service providers. The next slide is about how do you find your loved ones or your family after a disaster. Sometimes it depends on whether it's in the United States or if the disaster occurred elsewhere. For large-scale disasters, families can become separated and have difficulty locating their loved ones. So reunifying families is important to disaster recovery. So keep these resources in mind for finding a missing loved one. Google Person Finder is a web tool that Google stands up after a disaster. It is open to all and the content is not vetted. The Red Cross operates safe and well for survivors inside of a disaster area to register their status for loved ones. People located outside of the U.S. should always register with the State Department, even if they are a student or traveling. And also, after a local disaster, Maryland Human Services can rapidly open up a family reunification hotline as needed. Now, we've personally used the Human Services and worked with that team, and I can vouch it's an excellent service. So next slide. This is simply an example for an example of property-specific instructions. It's an infographic. It's a concise summary that includes what the occupants of a property should know about that specific property. And I borrowed this from a housing authority elsewhere because it does cover a number of important things for tenants to know and that case managers can review, and such as contact info for after hours. Is there an emergency assembly area? That's what we were speaking about earlier. Locations of the fire extinguishers, automatic external defibrillators, AEDs, and the pull stations, fire pull stations. Also evacuation instructions and things like that. Next slide. So here on this slide here, it's just a summary of what you want your residents to have information on. It's pretty much a summary of the previous infographic. Next slide, good to know regulations. For those who are interested in learning more about public access automatic external defibrillator programs or Stop the Bleed training, I have provided these links. This is also another good reference to have is the Maryland Fire Codes. Keep in mind that each local jurisdiction will likely have additional codes that would be available through their local fire marshal office. If there is no local office, then it defaults to the state fire marshal. So the next slide is really, it's about reducing hazards within the home. And emergency preparedness is not only about disasters, it can also include hazard reduction, which is also known as mitigation in the home. So please review with the client the simple preventive steps that can reduce risk. Cooking and fire safety is critical for all occupants of a building. Never leave food on the stovetop. Don't use aerosols around flammable vapors. Don't burn a candle unattended. Homes with children should use passive measures to prevent injuries, such as baby gates, cabinet locks, and childproof lids. Heavy furniture or TVs should be strapped or use hardware to secure them from tipping. Of course, smoke detectors in all sleeping quarters. So on the next slide, this is something that is often overlooked, but I call it documents to go. When we do disaster recovery, it becomes obvious that many people don't have the documents needed to apply for services or benefits, and most households have difficulty in containing and managing the vast amount of paper and documents that must be retained. And case managers can help clients by identifying what constitutes an important document that should be kept in a secure manner and easily retrieved if necessary. This list is not comprehensive, but it does include the most common vital documents. I mention this because disaster survivors need some of these documents in order to apply for various services, so it's wise to make copies in case the originals are destroyed in a disaster. So now we're going to talk in the next slide a little bit about COVID, the next 3 slides. Some of the things that we have as actions we've taken as an agency or in cooperation with other agencies to help people with disabilities during this COVID ecosystem, if you will, this disaster. First, we do have a constituent services hotline. This hotline has enhanced monitoring on the evenings and weekends. It's answered during the day, and we can provide support for case managers and also referrals. And also we've done a ton of problem solving, especially as it pertains to the face coverings, masks, access to medical care. The list goes on and on. Accommodations and communication support at state test sites. So we have assistive technology in all of our alternate care sites and field hospitals and at state test sites. Now, there are many test sites that are privately operated, not operated by the state. And so specific accommodations would have to be requested. Speaking specifically about communication support, such as interpreters for foreign language or for American Sign Language, we have remote interpreters available. We do have a program with Maryland Human Services for community feeding for individuals who cannot get access to a distribution point for food. We do have a program through the end of October for delivery of food and groceries. And this is not like Peapod or, Instacart. This is USDA agricultural food that is brought in boxes to an individual's home and delivered to them. If you have a client who needs food or needs COVID information, 211 is the service, is the entry point, and they can provide whatever referrals are needed and locations that are available in that area. And they have a series of questions we have provided that, if the individual due to a disability cannot get to a feeding point, they will be referred to us and we will make those arrangements for them. Also, if you do have a client that returns a positive COVID test and they have any needs whatsoever so that they can quarantine for 2 weeks or whatever the health department has recommended, they can call their local health department and tell them what they need, if they need food, if they need other support. And those requests will be managed. If they're not managed, please let me know and we will get them in touch with the right person. Next slide. We've also arranged for individuals with disabilities who are hospitalized or in a healthcare facility, should they need a support person to help them receive equal access to information, equal access to decision-making pertaining to their healthcare, they are permitted to designate a support person. And that policy was signed by Secretary Beatty and Secretary Neal for Department of Health. We do have other services related to food. Individuals who receive SNAP benefits, we applied for a waiver. When I say we, it was a team and it was not Department of Disabilities, although we did have frequent communication with the team that applied for a waiver. So Maryland beneficiaries of SNAP can receive delivery of groceries. Now, they have to pay for the fee if there is one to deliver the groceries, but some retailers waived that fee, Amazon and Walmart being the 2 that I'm aware of. Prescription refill requirements. Prescriptions can be refilled, a request for a refill can be made, and I'm sure the insurance representative will probably have more information on this. This was early on in the pandemic, so that you don't have to wait the full 30 days or whatever it is to get your prescriptions refilled, to ensure that there is no chance that you will run out of your required prescriptions. Accessible information, we have an entire team devoted to making information accessible and converting the executive orders into an accessible format. And then last, on the next slide, you probably would like to keep this information for the future. If you have clients or even yourself who need a COVID test and cannot go to a testing site, you want to take your test at home, this link takes you to the webpage for LabCorp. They have a program where you just do a simple survey, answer a few questions. They will send you a test kit, does not cost anything. They do request your insurance information. If you have no insurance, that's fine. They'll send you the kit anyway. There's a program that pays for this. And so there's no charge to the recipient. The test kit arrives the next day via FedEx. No doctor's order is required. It just cannot be any easier. I have taken this test a few times after some exposures. I will say, just as a sidebar, the easiest, it's important that you return the test on the day you actually take your specimen. So I recommend you take the specimen early in the day, and then you can call FedEx and ask for some express overnight shipping, and they'll pick it up. Again, you don't have to pay for any of that. So next slide. You all have been incredibly attentive to listening today. I really appreciate that, and I apologize again that I was late to the party this morning. I was following the wrong technology. So anyway, if you have any questions, I'm here, and thank you again. Chelsea?
Great, thanks, Cecilia. And I take responsibility for not being clear in the links that I initially sent, so don't worry about being a little late. We had a lot of people kind of join in throughout the call, and there were some technical difficulties for folks, so I apologize for that as well. So thank you for presenting. I don't know if anyone in the group has any questions for Cecilia while we still have her. I'm looking at the Q&A. You can also raise your hand as well, and I can unmute you if you would like to ask a question. I believe on the phone, unmuting is *6. Not completely positive, but I believe it is. If you have a question and you are joining by phone, I see we have 2 people who are on by phone.
Chelsea, this is Diane. The question we've had a couple times so far is, will the handouts or the information be available to people later? So we will send a copy of the PowerPoint presentations to all the participants later this week. And Cecilia, I don't know, do you have any additional handouts that you would like to send to folks? Because we could do that as well.
Yes, I will send them to you and Chelsea today. I have sort of the template forms, and then the other document is the toolkit for planning for disasters for people with access and functional needs. So yes, I do.
Okay, great. Yep. So we'll get that out to everybody. We'll do it through Constant Contact. So, and we can also send a link to the recorded webinar for you.
And if I may, I hate to interrupt, but I wanted to add one comment about the COVID test that I mentioned. I cannot verify. There's no time. They have not given us an end date for that program. So sometimes those programs end suddenly. So if it's something that you feel you or a client would need, I recommend ordering the test. But also I use them because I still have to do some travel. And sometimes people have to travel in and out of areas that have a higher positivity rate of COVID. So it's very useful for these situations where, you know, you'll be returning home and you may need to self-isolate or quarantine, and that way you can take that test right away and have it available. So anyway, as things open up, I think some of these testing requirements will become more common. And that's all I had to say about that.
That makes sense to me. So since I don't see any questions, I'm going to do a little poll, and these are based on questions that Cecilia had sent to me in advance. So let me know if this works. Hopefully people can see these 2 questions. And I will give you all, let's see, about a minute or so to respond. Okay, looks like we have some people voting, and then Cecilia can tell us if we were correct. It looks like a lot of people were paying attention, which is great, and the information was, extremely helpful. So I appreciate that a lot, Cecilia. And in this constantly changing environment, I think it's even more important for people to have some kind of disaster plan, particularly if family is out of state or even in a different county, very far away. We need, to have emergency contacts is pretty critical. All right, I'm going to end the polling now. Looks like we had, the first question was, mitigation includes the actions taken to reduce the impact of a disaster. It looks like we had 93% voted that as being true. And the second question, what number should an individual call if they need assistance finding food during a disaster? And that is 87% said the 211 United Way helpline. That is excellent. Okay, very good. Well, thank you, Cecilia, for joining us. If anyone has some follow-up questions for Cecilia and you join via the phone and you weren't able to unmute yourself, please go ahead and email those to me and I'll make sure that we get them her way so she can answer. She has been very busy during these last several months and working a lot more than she had prior to COVID, at least. I know you're always working hard, Cecilia, but my goodness, you've been working around the clock. So
Yeah, thank you.
I appreciate you taking the time to join us today for this this presentation. So that's about all I have for that. I just wanted to give a quick, before we have our colleague from the Insurance Administration present, I wanted to give a quick plug for the next upcoming webinars in our series of case manager, property manager meeting related webinars. Our next one is going to be taking place on October 14th. So that's next Wednesday, also from 10 to 12, same time, same place. Please keep in mind that each webinar has a different registration link. I saw a couple people this morning trying to access the same link that was sent out for last week's webinar. They are all different. So once you get that registration link in your email, which should come from our department, you should get the link to register for the webinar for that specific day. Make sure that you register in advance that way. Don't use links from prior meetings. So the webinar taking place on the 14th is called Leasing a HUD 811 unit. It's focusing on income calculations, medical deductions, and doing a deeper dive on what that process is like. We're going to have Christina Bulliard from our own department, our waitlist administrator, and Karen Scott, who's the regional manager at Habitat America, will also be presenting. So really excited to have them as panelists for that presentation. And our October 21st webinar is going to be it's going to address two different subjects. It'll be focusing on disability awareness and labels, ensuring that there's an understanding of what kinds of labels or assumptions you might have of people with disabilities, and not relaying those assumptions to residents living in units, really thinking about ways that inclusivity can be considered, and also ensuring that there's not any discrimination against a person with a disability based on maybe preconceived notions that you might have. And that presentation will be done by some of our staff from the Centers on Independent Living, the CILs. And we're also going to have, as part of that same day, a Tenant Training 101 presentation, which is going to be a deeper dive into the actual process of doing a tenant training. We do this with all of our 811 Weinberg residents, community choice home residents, and the MFP bridge subsidy residents after they have moved into a new apartment. And this process is really kind of almost very similar to some of the things that Cecilia addressed in her presentation, making sure that people understand the features of their unit, how to use an oven properly, how to use their thermostat, how to make a request for reasonable accommodation or modification to the unit, what that entails. So we're going to go through the whole thing with everyone so you feel comfortable doing those independently with clients that you're serving in the program. Of course, now we're doing everything through the phone or through Zoom or Google Meets. So it's a little bit different than it used to be, but typically those are things that we do in person pre-COVID-19 days. So, all right, well, without further ado, I want to introduce Gia Wilkerson. She is from the Maryland Insurance Administration. The Maryland Insurance Administration, they are working on a specific initiative to inform people about the benefits of renters insurance, and then also to explain what kinds of different coverages are and also what kinds of different policies are available throughout the state. So they provide a wealth of information to consumers about insurance. They also talk about homeowners insurance, so this is not the only type of insurance that they have educational materials on. They also address life insurance, health insurance, really any type of insurance. Their department works really hard to inform the public about, things like premiums, rates. They also accept complaints or concerns about insurance policies, perhaps where people feel as if they're being overcharged for a policy or they're experiencing challenges with getting the company to assist them related to a claim that might have not been accepted for some reason. So they are definitely a mighty department, and I've done a lot of work with them in the past. So I'm glad that Gia is able to join us today. And I'm going to pull up her presentation. So give me 1 second here. Okay, so I know it's really tiny. I'll make it bigger. Okay, let's see. There we go. Perfect. I did see possibly a question, Diane, that was in the. Okay,
Yep, I see it too. Actually, why don't I go ahead and read it while you're getting that presentation up? The question is, when will the links for the next 2 case manager webinars go out?
Okay.
So the link for the webinar to register for the webinar on the 14th has already been sent out. I'm going to probably today or tomorrow send one more announcement so that people can continue to sign up. There is still capacity to sign up for that webinar. And then the link for the 21st, the webinar about disability and about the tenant training will go out today. It is a bit different. We are having people register directly through Zoom this time. So if you get that notice and it looks a little different, that's intentional. And so we're gonna give it a try and see how it works with people registering directly through Zoom.
Great, thanks Diane for explaining that. And yes, as everyone gets more accustomed to this new technology, we're always trying to change the ways that we get information out to people. And we also try to streamline the process when and where we are able to. So, all right, so Gia, I'm gonna go ahead and unmute you. So you should be good to speak. Can you?
Yes.
Okay, great. All right.
Good morning, everyone. Thank you so much for having me, and thank you for that wonderful introduction, Chelsea. As Chelsea mentioned, my name is Gia Wilkerson. I'm with the Maryland Insurance Administration. I represent the Consumer Education and Advocacy Unit. We often joke around and kid that we are the face of the agency, As pre-COVID, we used to travel throughout the state, making sure that consumers were informed about their rights when it comes to insurance, and then just that we were there in case if they needed someone to help them. Next slide, please. So this presentation does not provide any type of legal advice. You and your client should definitely discuss specific questions with your trusted financial advisor or insurance producer. Next slide. Today, we are going to talk a little bit more about what is the Maryland Insurance Administration, what is renter's insurance, what does a renter's insurance policy cover, frequently asked questions, renter's insurance, and introduction to our rate guide. So we also produce our own educational brochures and materials as well. What to do after a loss, being prepared, and then how to contact us. Next slide, please. As Chelsea mentioned, we are the state agency that regulates insurance in Maryland. In addition to that, we also license insurance companies and insurance producers, agents, or brokers. We examine the business practices of licensees to ensure compliance. We monitor solvency for insurance companies, review and approve insurance policy forms, rates to ensure that rates are not inadequate, excessive, or unfairly discriminatory. We also investigate consumer and provider complaints and allegations of fraud. Next slide, please. So if you ever feel that you or your clients have been unfairly treated by your insurer or insurance producer, please feel free to file a complaint. So examples of improper actions include improperly denying or delaying payment all or portions of a claim, improperly terminating your insurance policy. So typically when an insurance company is going to cancel your policy, they have to send you something in the mail. They can't just terminate your policy. So oftentimes they will send it certified mail just to make sure that you receive it. So as long as they have that proof that they sent it to you, then 9 times out of 10, they are okay with terminating a policy. So it's very important that you open every piece of mail that you receive from your insurance company. If your insurance company raises your insurance premium without proper notice, when they send you a notice of increase in the mail, typically on the back, you'll have a form that says you have the right to protest. So if you don't agree with that rate increase, fill it out and send it back into them, and then they have to justify or explain to you why they are raising that rate. If your insurance company makes false statements to you in connection with the sale of insurance or processing of insurance claims, and if they are overcharging you for services, including premium finance charges. Next slide, please. So what is renter's insurance? Our agency, during COVID, we were trying to figure out what we could do to make sure that we stayed in contact with consumers throughout Maryland, and what are the areas of interest that we needed to focus on the most. And we find that oftentimes a lot of constituents don't have renter's insurance because a lot of them often don't know that the product is available, or they're not sure what it is, what it covers, or if they can even afford it. So if you rent an apartment, a house, or a room in someone's home, your personal belongings will not be protected against loss or damage unless you have a renter's insurance policy. Most homeowners carry a mortgage, and therefore they have no choice but to purchase homeowners insurance. But again, that homeowner's policy is only going to cover their personal belongings. It will not cover yours if you live with them. So for renters, the choice is usually your own, and you may choose to go with or without renter's insurance, even though you may face a lot of the same risk as homeowners. Next slide, please. So your landlord likely has an insurance policy that is responsible for structural damage to the building. So that means that the landlord is not responsible for damage to or loss of your personal property. Your landlord's insurance will not protect you from being liable for damage you might cause to the building inadvertently. Per se, if the kitchen catches on fire, if the tub runs over, if your toilet is backed up or anything like that, or if others are even injured on your property, you will be responsible for those. Next slide, please. What does a renter's insurance policy cover? Renter's insurance policies can cover everything from electronics to clothing to household appliances. Even a minimal number of items could add up to thousands of dollars worth of personal property, which can be covered in a basic renter's insurance policy. Some of the small things that we don't even think about, as far as cleaning supplies and even down to toothpaste. Those things, when you have to replace all of them, they add up relatively fast. Many policies do not limit protection to your belongings located in your home or apartment. For example, items that often are covered if they are stolen by someone who breaks into your car, or if they are damaged by a covered peril while not on your property. Next slide, please. A renter's insurance policy will also cover additional living expenses in the event of a covered loss that makes your home or apartment or condominium uninhabitable. So if there's damage to the building you are renting and you must live elsewhere while the building is being repaired or while you relocate, you will have coverage from additional living expenses during that period of time based upon the terms of your policy. A renter's insurance policy also covers your personal property and your personal legal responsibility for injuries to others damaged on your property. Next slide, please. So when you are shopping for renter's insurance, it's important that you understand what's covered, such as fire, wind, hail, theft, vandalism, anything that can cause damage to your property. Make sure those things are covered under your policy. Some policies cover all of those things. Some of them may only cover one specific thing. So if your home is damaged by one of the things that I mentioned and it's not named in the policy, then the damage will not be covered. So for example, if you have a policy that says it only covers damage caused by fire and you incur wind damage, then your insurer will only pay for fire damage. It will not pay for the wind damage. A policy that only covers one peril will likely be less expensive than one that covers multiple perils, but it's essential that you understand the limitations of your policy. Next slide, please. Some of the frequently asked questions that we receive: how much coverage do I need for my household property? This depends on the value of your personal property. You should start by making an inventory of your personal property and determining the value of that property. Group items together in categories or by room. Don't forget rarely used items as well. Make sure that you photograph or videotape each item or room. So if your clients are unable to do it themselves, this may be something that you may want to help them with. You can use your cell phone, video camera, even down to their appliances. So often in the microwave, the stove, the refrigerator, there'll be a label. And on that label, it will say the name of the product and it'll have the serial number. And it's important that the inventory list is updated regularly. So each time that your client may buy something new, or each time they may receive, additional equipment or their medications changed, all of those things should be updated along with that inventory list. And the inventory list can be stored either on a cell phone, it can be stored on a computer, a flash drive, the Google Drive, the cloud. Case managers, you may even want to save it yourself or send it to one of their family members in case if something happens and the property is destroyed, they'll have a copy of that somewhere else as well. And then a safe deposit box is good too. And updated inventory always makes it easier to file an accurate, detailed insurance claim in case the property is damaged or destroyed by a covered loss under your insurance policy. Next slide, please. What does actual cash value and replacement cost value mean? So these are also two types of information that are offered under your policy. So actual cash value is the coverage that provides you with the cost to replace your personal property up to the limit of the insurance policy, minus any type of depreciation for the age or condition. Replacement cost value is going to be the cost of replacing the damaged or destroyed property up to the policy limits without any depreciation or deduction. Another question we often receive is, when I was a homeowner, my policy didn't cover damage caused by earthquakes or flood. Is it the same with a renter's insurance policy? Damage from earthquakes or flood are generally not covered by a renter's insurance policy, but may be available to you as a separate policy. The National Flood Insurance Program provides flood insurance in many areas. You can find out more information to find out if you live in a flood zone or floodplain by visiting www.floodsmart.gov. Next slide, please. One of the major questions that we get is, how much does renter's insurance cost? So the actual cost depends upon the amount of coverage that you want, the type of coverage, whether it be replacement cost value or actual cost value, and the deductible that you select. The average renter's insurance policy costs between $15 and $30 per month. Replacing all of your possessions or being liable for an accident on your premises will cost way more. Are discounts available? Insurers will often reduce your premiums if you have fire or burglar alarms, fire extinguishers, sprinkler systems, and or deadbolts on exterior doors. Some insurers might also offer discounts if you have more than one policy with them. So say if you have an auto insurance policy and a renter's insurance policy, often that will decrease the amount of your policy. Next slide, please. So one of the other publications that we produce is a renter's insurance rate guide, which helps consumers to comparison shop so that you're not just going with one company. You're able to see how much the policy would be with multiple companies. So comparison shopping is the key to getting the most out of your insurance dollar. Tips for getting the most out of your insurance shopping: make sure you provide the same information to each insurer or insurance producer. It may seem like a lot, but you don't want to leave anything out because that could alter the cost that they may quote you over the phone. Ask about discounts, ask about deductibles and when they apply, ask about what is covered and what is excluded. In addition to the price, consider factors such as coverage limits and customer service. Ask friends and neighbors about their experience with different insurers. On the next slide, I'm going to go over the renter's insurance rate guide. Next slide, please. So this guide is strictly used for educational purposes only. It's not intended, again, to provide legal advice. Next slide. So this is just the cover of our renter's insurance comparison guide to rates. We update this guide typically twice a year, usually in the spring or fall. Next slide. So I know it's small, so everyone will also receive one of these if you have not already, and it's also on our website. So within the renter's rate guide, we have scenarios in our book. I know the font looks extremely small on the computer, but the next page will have a snapshot to make it a little bit easier. And in the rate guide, we also have 1 or 2 counties per scenario. Okay, so this is a close-up of the actual slide. So first you see listed is Allegheny County, and then the rates published in the book are based on the scenarios. So for Allegheny County, we have a renter that lives in Cumberland who is insuring $50,000 of personal belongings under coverage C amount. The home or apartment of the frame construction, and then the number assigned under protection class, which indicates the distance from the fire hydrant or fire station. It's a score from 1 to 10, 1 being the best score. So the deductible for this scenario is $500. The next columns are not applicable to this quote. So the rate does not include a home auto discount that you might receive if you are purchasing your renter's insurance policy from a company you also have a auto policy with. And the liability coverage is $100,000. Next slide, please. And then this slide is a full page of the rates that were published earlier this year for the version of this guide. So this just gives you a layout of what it looks like. To the left, it gives you, it states Western Maryland, Washington, D.C., the suburbs, and Southern Maryland. Then the date when the rates are effective, the carriers, and then some other important information. Then to the right, we have the company, the counties, and the zip codes. Next slide, please. And then this is a close-up from the previous slide. Here you can see that the rates are offered by the insurance carriers, giving you a great place to start for your comparison shopping. Next slide, please. So in all of our rate guides, we give you space to jot down notes so that when you call and compare, you're able to keep up with the information that you receive from each company, so you're not stuck with too many pieces of paper. So the worksheet is just basically broken down to give you the company name and then the policy comparison to the right. Next slide, please. And this brochure is also available on our website, but again, I'll also make sure that everyone receives one. Next slide. So after a loss, it's very important that you promptly contact your insurance company. Take photos and videos of the property to clearly show the damages. Before you remove anything from the premises, make sure that your insurance adjuster or insurance producer has seen the damage. As soon as possible, prepare a detailed inventory of everything that was damaged. Keep a copy for yourself and give a copy to your insurance adjuster. Make sure that you include a description of the quantity of the items, what it looked like, what happened to it, how it was damaged, the date and place of purchase, and the approximate age of other proof of ownership, which will come in handy when you do your inventory checklist. Next slide, please. Keep all receipts for any emergency repairs. Be present when the insurance adjuster inspects your property. Make sure that you walk around with them throughout your property. Do not accept any inadequate settlement offer. If the insurance adjuster gives you a check and you cash that check, then you are agreeing to that amount. If your insurer denies any part of your claim, be sure that they put the denial in writing and keep it with all of your paperwork. Next slide. So again, create an inventory of all of your possessions and keep it updated. A good reminder for me to update my inventory list is usually during daylight savings time. Before, it was when I needed to change the batteries on my smoke alarm, but now because we have these fancier alarms, I don't have to change the battery as frequently. So photograph and video each and every room. Safeguard your records, your insurance policies, inventory lists, all of your important information. Keep handy your insurance producer's name, telephone number, and your policy numbers. Next slide. And don't forget that we are here to help you. If you have any questions, if you're not sure about your policy, if you're not sure that the insurance agent or broker is licensed, feel free to give us a call. This is our contact information. And then the next slide. Additional resources, the National Flood Insurance Program, the Maryland Insurance Management Agency, and FEMA. And last slide. Thank you so much for your time today. Please let me know if you guys have any questions.
All right, I'm checking the Q&A. I don't see anything quite yet. And I wanted to see, I was trying to set up a poll to help with the presentation at the same time, but you you shared a lot of great information, Gia. That was very helpful for me as well. Looks like I do have one question from Karen Scott. What are the most common losses for renters?
I would say oftentimes a lot of renters lose everything because we've had a couple of explosions with apartment buildings. So they've lost everything. And we find that when we go out and we speak to consumers, a lot of them feel as though because they don't have a home, that they just have, an apartment or, a townhouse, that the things that they own aren't that significant. But I feel like anything that you put your hard-earned dollar into is significant. Anything. One of my former colleagues, with his home inventory, he showed us a video that he did down to a tube of toothpaste. And it wasn't a new tube of toothpaste. It was a tube of toothpaste that he rolled up. And he was like, down to this tube of toothpaste, I want my money back. And he said, if you think about it, down to all of your cleaning supplies, like I mentioned earlier, all of those things are quite costly. And, some of the things that we may take for granted just because we have it. But if we remember when the pandemic started, one of the hardest things for us to find was toilet paper. So.
Yep, that's a great point. Allison Garraway is asking, do you do workshops for residents?
Yes, ma'am.
Okay, great. Very good. And we have another question here. Would you recommend renter's insurance for individuals that are residents of DDA residential sites? That's from anonymous attendee. I assume that this person's referring to group homes potentially. I'm not sure, but what are your thoughts on that, Gia?
I say yes.
Yeah.
Because again, it's still, even though they live in a group home, they still have their belongings there. So if something happens to the group home itself would be covered, but everyone else's contents inside would not be covered, and they would not be able to replace that.
Yeah, that's a great point. One of the things I think is prior to owning a home, I had always maintained a renter's insurance policy. And the reason being was really because it covered more than just what was in my apartment as well. And you mentioned that in your presentation, that some policies covered different things, including personal possessions that could be in your vehicle, for instance. So, I've had friends who've had auto thefts, things that were stolen out of their car, and they were able to have their renter's insurance cover that theft. So it's good to really look at what the policy covers and make sure it's meeting your needs. So.
And with the pandemic, I was just on a meeting prior to this for PG County, and they were speaking about the amount of theft, the car thefts that have increased. So it's definitely good to have that, renter's insurance policy in case if something is stolen from your car. I actually had my boyfriend, someone stole some stuff from his car right in front of our house. And none of my neighbors, it wasn't visible on the ring alarm. We could just see the person walk to the car, and then it's like the person vanished. But they went through the entire car and the trunk.
It's just, yeah. With people also being more likely to be at home now, during the pandemic, for things like theft increases. So, yeah, it's a very real issue. We have another question from Karen Scott. Is there something that renters often think landlords will cover that actually they need renter's insurance for that might surprise people?
I know we did recently have someone that called in and complained because they were renting and they put in new appliances, and they thought that the homeowner was going to cover it, and they did not cover it.
That's interesting. So what happened to the person then was that the new appliances were put in, and then the expectation was that the person would pay for them, or what?
Well, the person, so they were renting a home, so they decided to put in new appliances themselves.
Oh, gotcha.
And something happened. I think the neighbor's house next door caught on fire and was destroyed, and they didn't have renter's insurance, but they thought, especially since they put in those appliances, that would at least be covered, and it wasn't.
Interesting. Karen Scott asks, is food a coverage of renter's insurance, for example, an electricity loss or mechanical failure? So I assume she's referring to like if a refrigerator failed or something of that nature.
That is a good question. And I'm not 100% sure. I know that additional living expenses covers food if you are misplaced. But I'm not 100% sure. I'll have to check on that.
Okay, gotcha. Sounds good. Stacy Tobin asked, does renter's insurance cover you against injuries of others in your rental like a homeowner policy would?
Yes.
Yeah.
Yes, it does.
Great. Okay, and so Karen, we'll follow up with a response to that. Gia will look into that for you, and we'll figure out an answer for you. I'll look in the chat as well. Don't see any questions.
So the liability portion of your renter's insurance policy covers injuries to others and their property caused by your negligence, and medical payments coverage for others that are hurt while on your property, even if it's not your fault.
Gotcha. A question that I was wondering about, if someone has a renter's insurance policy, and they experience an issue like a flood in their apartment or something of that nature, but some of their belongings are, they're not sure maybe of all of their belongings, and some of them are kind of removed by the property management company, perhaps, just as a quick mitigation that they're trying to do to make sure that there's not further water damage to the items. What would someone do in a situation like that? So would they have the right to request, access to those damaged items to make an inventory after the fact, or how does that work? Is that even like something that could be considered?
I would say you would think that they would be able to request to have access to their items. But again, that's why it's important to make sure you have that inventory on handy, because then it could also be a thing of your word against their word.
Right.
Too.
Yeah, we've had, of course, things happen in any structure that you live in. So there's always an opportunity for systems to fail and for all kinds of damage to occur to units. And that's just part of multifamily living. No matter how you look at it, it's going to happen, even if it's a brand new building. So I think that having renter's insurance is such an important thing. I can't encourage people enough to try to get clients interested in shopping for renter's insurance for themselves, just because it really does do a huge benefit to the person in the event that something happens that was unforeseeable. So it's something we always encourage case managers to discuss. And we do discuss it as part of our tenant trainings that we do with new residents to the 811 Weinberg Bridge Subsidy programs as well.
Chelsea, I have a question. Gia, I have a question for you. This is Diane. If a property has water damage, some extensive water damage, let's say a broken pipe at the property, and it results in flooding of some of the units and then resulting mold, and people need to be living elsewhere, would their renter's insurance cover their accommodations at a hotel until that's repaired, or would the property be responsible for doing that?
If they had a flood insurance policy, then that's something that probably would be covered under the flood insurance policy. If not, then it more than likely would be the responsibility of the property, because renters insurance policies do not cover flooding.
Right. Thank you.
You're welcome.
Yeah, one of the most common things I would see when I was working more in single family with homeowners was people that only had fire insurance because of the fact that it's really cheap. And one of those things that, as you had mentioned previously, some people might have a coverage that's just for one thing because it's the most affordable thing for them to have. So often that would disqualify them from getting assistance through different state loan programs because they don't actually have a full homeowner's insurance policy. So I think, if you're working with anyone as well who is a homeowner, or if you have clients who live with family that owns a home, then benefits through different programs and services might be impacted based on what kind of coverages they have on the property. So definitely a great presentation. Thank you, Gia.
Thank you for having me.
Yeah, you're welcome. I just wanted to, I actually have all of her literature on hand. So if anyone wants copies of these things, if you want me to mail them out to you directly or to your agency, I can do that. I was going to send all of these documents or deliver these to different properties where we have 811 and Weinberg units. There's also a really great document that the Insurance Administration produces on natural disasters. And this is really, really helpful. It includes resource lines for people to call, FAQs. It's a great companion document to some of the things that Cecilia presented on, and also things that Gia just went over as well.
And Chelsea, it also has a space towards the back, maybe around 20, 21 somewhere, but it has an inventory checklist in there too.
That's awesome.
So it has like the rooms and the lines for you to write down the cost. Yeah.
Very comprehensive, and it's a great tool to incorporate in tenant training when you're working with tenants who've just moved into their new unit. And, you have to really think about, it's possible that people that you're working with have never rented an apartment before in the community. So a lot of this stuff is not, maybe for you, it's something that's common sense. It might not necessarily be that way for people that you're working with. If they've been in a nursing facility for an extended period of time, a renter's insurance is not necessarily going to be the first thing that pops into someone's head. And it's something that, as Gia mentioned, a lot of people don't even know that it's something they can get. They have this idea about homeowners insurance being the one thing that they have to get if they have a mortgage and they've purchased a home. Renter's insurance might not necessarily be something that comes across their minds, and they might also think that the property will cover anything if there's any damage or loss to their personal belongings, which is not the case. So it's really, really important that this coverage is something that people look at, and I think that the Insurance Administration makes it a little bit foolproof because all of these documents are very, very comprehensive.
Gia, this is Diane again. I have a question. Can we send any of the documents that you have to people as a PDF or something like that? If we're able to do that, if you can get them to us in a document form.
Yes, absolutely.
Okay, so if you can just send them to me and to Chelsea, then we'll send stuff off to folks. And also, are these brochures available on the Maryland Insurance Administration website?
Yes, ma'am.
Great,
Yep.
thank you.
So they're pretty standard. The only thing that we typically update, unless the law changes, are the auto, homeowners, and renters insurance comparison guides. They are usually changed about twice a year to include any updates as far as rates or companies.
That's great, thank you.
Very good. All right. Well, if no one has any other questions, I hate to end early, but I do want to just give, again, a thank you to Gia for joining us. Thank you for everyone who joined this webinar this morning. I, again, want to plug, if you were late for joining the webinar, next week on Wednesday, October 14th, we will have another webinar in our series of property manager, case manager webinars for the month of October. Our next one will be about leasing a HUD 811 unit, income calculations, and medical deductions. So what happens oftentimes in our programs is when somebody is going through that application process, all of that is something that the property manager is looking at. Christina Bulliard from our department, who assists in gathering applications, is looking at some of those leasing steps that a person has to go through. And there's a lot of questions about that. How is income calculated? Do they look at TANF? Do they look at different types of benefits that the person's receiving? Do they look at things like, child support payments, things of that nature? So what is included in an income calculation? medical deductions, they're gonna, that's something that when the property manager is looking at that, there's gonna be questions about what counts as a medical deduction. Is it gonna be prescriptions? Will it be things like, medical bills, outstanding medical bills? So Christina and Karen Scott, who's regional manager for Habitat America, will be going into a deep dive on those topics. We're very grateful that they have volunteered their time to do so. Our next webinar after that will be our October 21st webinar, which will be including a presentation called Label Jars, Not People, presented by some of the Centers for Independent Living staff. And they're gonna go over disability awareness training, and then also ensuring that people are not relaying any stereotypes they might have about people with disabilities to their daily interactions with a person with a disability. And in addition to that, we're also going to have a Tenant Training 101 training, which will go over all of the things that we normally cover when we do tenant training with new residents. So that process is really looking at some of the checklist items that we go through. Did you read the community rules, and what kinds of questions you have about that? Are you familiar with the overnight guest policy? Things of that nature. So we'll talk a little bit more about how we do that as well. I did see, let's see, it looks like I got a question. Abiola. Okay, Abiola was just asking to be re-added to the distribution list. If you have any, that actually brings up a good topic. If you have any colleagues that want to be added to our distribution list, let us know so they can also get these emails. New people that work for your organization that are just starting to break into the housing world. These are very helpful webinars to attend. And we will, of course, make the links available to the recordings and all of the PowerPoint as well. So, all right. Well, thanks everyone for joining. I hope you have a great rest of your Wednesday. And I will go ahead and conclude this webinar. Thank you, everybody.
Thanks, Chelsea. Bye-bye.
Thanks, Gia. Thank you for joining us.
Thanks, everyone. Bye-bye.